Coming up next, you'll have an opportunity to get a taste of some of the complexities associated with credentialing, recredentialing, and privileging in the healthcare system as a means to attempt to control the quality of care that's being delivered by looking at the qualifications of the practitioners who want to get on staff or stay on staff. I have with me Vipul Kella, who is an emergency department physician, expert witness, and somebody who is deeply knowledgeable about the credentialing process. What were some of the things that we covered in your podcast?
Credentialing is a highly complex process. There's multiple areas, multiple layers that the average practitioner does not know that hospitals and credentialing bodies need to look at when granting credentials. What we're seeing now with during COVID and beyond is that the process has become even more complex because you're looking at providers getting credentialed in multiple facilities. They may have licensure in multiple states, and there may even be new specialties that are forming. So if you look at it from a credentialer standpoint, the amount of data that they have to now deal with has become growing exponentially. That makes their job even harder. What's called for in the market now are new solutions in digital health, AI, blockchain that could potentially address this problem. They could add a lot of efficiency, decrease the administrative burden, add a lot of security and lower costs for the credentialers. So that's an area of a lot of innovation, and I think an area that will see a huge improvement in some of these technologies for hospitals and credentialers in the future.
So some of the things that we touched on, including the credentialing and the recredentialing, was also the role of the National Practitioner Data Bank, a unique institution that was formed to try to prevent physicians in particular from picking up stakes and moving out of the area and leaving nobody in the future any understanding about what they had gone through. And you brought up some fascinating things about the use of AI and how that can be part of the credentialing process and some of the challenges of being objective when a colleague, a good friend, wants to be recredentialed and yet has a series of problems or poor outcomes in their background. But there's a lot of pressure on the hospital to keep them on staff. So be sure to come back to Legal Nurse Podcast and hear Dr. Kella's take on this as he talks about the credentialing process in healthcare. We'll see you then.